immobile over time. So typically by the third decade of life, they are requiring a wheelchair and need continuing care. The median lifespan for these patients is about 40 years of age, and most deaths occur due to thoracic insufficiency syndrome, as bone is forming around the neck and spinal area. Complications can also include pneumonia and right-sided heart failure. So what does this look like genetically? FOP is monogenic in nature. It is due to a heterozygous gain of function mutation in the ACVR1 gene. This mutation can be sporadic or inherited, and it is inherited in an autosomal dominant pattern. This mutation consists of an adenine replacing guanine at codon position 617, so it is a single nucleotide substitution, and as a result of this mutation, histidine replaces arginine at codon position 206 in the resulting ALK2 protein. Here we have our ALK2 protein. As you can see on the top left of the image, we have the R206 mutation. This gene codes for the ALK2 kinase receptor, which binds to BMPs in the bone matrix. And this is an activating mutation, meaning that it activates the pathway that would normally be inhibited. And the BMPs are part of the TGF-beta family of ligand, which typically block the proliferation and mineralization of osteoblasts. So there are very limited treatment options for this disease. There was one treatment that was just approved in August of 2023. It is called palovarotene, and it is a retinoin receptor GABA agonist. It is administered as a pill once daily. And there is also steroid prophylaxis that is considered for symptom management of this disease. However, it is only for symptom management and not to treat the disease. However, there is another option for treating this disease or even curing it, which would correct the underlying disease mechanism, and this is gene therapy. One of the most common mechanisms of gene therapy is called CRISPR-Cas9, which stands for clustered regularly interspersed palindromic repeats. This technology uses RNA that matches the mutant DNA and the Cas9 enzyme in order to repair the mutant DNA, as you can see in our figure here. Another mechanism of gene therapy is called RNAi, or RNA interference. It uses small interfering RNAs to silence a specific gene by degrading target mRNA, as you can see here. Which leads to my hypothesis, which is that administration of CRISPR-Cas9 and RNAi to the ACVR1 R206 mutation leads to decreased heterotopic ossification by amplifying levels of non-mutant mRNA. So for my first aim, I will be using a mouse skeletal muscle tissue culture that has the ACVR1 R206 mutation. For our first tissue culture, we will just be applying the steps of CRISPR-Cas9, and then subsequent mRNA levels will be measured using RT-PCR. We are looking for the non-mutant mRNA in this incidence. For our tissue culture number 2, we will be applying just the steps of RNAi, and subsequently measuring the non-mutant ACVR1 mRNA. And finally, for tissue culture number 3, we will be applying the steps of CRISPR-Cas9 followed by RNAi and measuring mRNA levels. And the expected result from this aim is that the highest level of non-mutant mRNA will be found in tissue culture number 3 that received the combination treatment. And based off of this expected result, we would assume that this treatment is the most effective for in vivo study. Which leads to our aim number 2, which will include 2 groups of 20 mice that have the ACVR1 R206 mutation. Group number 1 will be the control group, and group number 2 will receive the combination gene therapy. So here we have our mouse model with the ACVR1 R206 mutation. We will have initial CTs performed on all mice in both groups just to establish a baseline prior to treatment. For our first step, we will be administering the steps of CRISPR-Cas9 to group number 2. The method of delivery will be through an adenosine-associated vector, and it will be administered via IV. For the step 2, we will be applying the steps of RNAi to group number 2, also through IV, and the mechanism will be through siRNAs. And then after a period of 24 hours, we will be injecting cardiotoxin into the skeletal muscle on the forelimbs of all mice in both groups. And the purpose of this step is to degrade and injure the skeletal muscle to promote heterotopic ossification. And finally, after 6 weeks, micro-CT scans will be performed on all mice in both groups and evaluated for heterotopic ossification. And the expected result from this aim is that group number 2 that received the combination gene therapy will demonstrate decreased heterotopic ossification in comparison to the control group. And this result will provide evidence for CRISPR-Cas9 and RNAi's efficacy in reducing FOP-related heterotopic ossification, both by editing the mutant gene and degrading mutant mRNA. A future study that could be an extension of the in vivo investigation would involve taking observations of heterotopic ossification in both groups of mice 9 and 12 weeks after treatment, just to evaluate how heterotopic ossification proceeds. And in addition, a future study on humans could be conducted, assuming positive results, to further investigate the efficacy of CRISPR-Cas9 and RNAi for FOP. My acknowledgements include the Lord, first of all, Dr. Straw, my advisor, Dr. Franklin, and my family and friends.
What's the single most significant limitation to your study?
The most significant limitation would probably be in regards to CRISPR-Cas9 in relation to the immune system. Evading the immune system is a significant challenge of CRISPR because it is possible that the subjects could have antibodies to the adenosine-associated vector, and there is research that is needed to evade the immune system.
So second question, let's say you're right. How would you envision this working with potential patients in the future? Would they need to be screened genetically? Would they need to show symptoms? Would you try to administer it before symptoms? How do you envision that?
The typical diagnosis for FOP is through genetic testing. So ideally, first patients would be identified through the big toe malformations and would be subsequently genetically tested for the mutation. And ideally, this would be performed on younger patients in order to prevent heterotopic ossification. So I would say that the inclusion criteria would be the genetic testing. Yes?
Why is this disease commonly misdiagnosed?
It is very commonly misdiagnosed, partially because it is so rare. So it's not very common for physicians to see this, and especially because also the only external sign of the disease is the big toe malformations, and if they are overlooked, it can be easy for patients to present with like an inflammatory swelling or a little lump, and it can be assumed to be cancer. That's number one differential diagnosis, and then performing surgery or a biopsy on the lump will actually cause a flare-up and exacerbate the symptoms. Anything else?
Any other questions for the speaker?
Very good.
Thank you.
Great job.
Our next speaker is Zion Garza. Zion is graduating with a degree in biology with a concentration in medical sciences. He is from Yorkville, Illinois, and has been at SEU for 3.5 years. During his time at SEU, he has been part of SEU Worship and the Pre-Dental Waxing Club. After graduation, he plans to attend dental school. So welcome, Zion.
about cryotherapy treatment for periodontal disease. So, first, I want to talk about gingivitis. So, gingivitis is the least mild form of the periodontal disease, and it's affecting up to 90% of the population. It is a term used to describe gingival inflammation caused by the accumulation of germs and debris between the gum line. This also includes bacteria and the tooth, commonly referred to as dental plaque or calculus. Gingivitis is a reactive condition that can be reversed by improving oral hygiene. So this is something that can be reversed just by brushing your teeth morning and night, flossing, doing what you need to do to keep your oral hygiene up. Going to periodontitis, it's the world's 6th most prevalent disease, affecting approximately 743 million people and having a high prevalence of 11.2%. Periodontitis has grown to be the leading cause of tooth loss worldwide since it's attacking the periodontium ligaments. Periodontitis is referred to as persistent, damaging, and irreversible inflammatory disease state. So the difference between gingivitis and periodontitis is that gingivitis can be reversed while periodontitis cannot. Going more into it, gingivitis, if left untreated, basically becomes periodontitis. The bacteria can then infiltrate further into the tissue in the periodontium, which is shown in this picture, which includes the gingiva, the cementum, the periodontal ligament, and the alveolar bone. In the process of guarding against bacteria, the host defenses cause the periodontium to be destroyed and the gums to then subsequently become inflamed. Periodontitis causes the periodontium to lose its attachment, which then continues to the alveolar bone loss, potentially ending in tooth loss, which also creates gaps in your teeth, and things like that. Factors that could play into this would be smoking, diabetes, poor oral hygiene, stress, heredity, underlying immunodeficiencies such as AIDS, and female hormone changes such as like when you're pregnant or when taking oral contraceptives. Treatments as of right now are antibiotics, which help control the bacteria from underneath the gums. There's scaling and root planing, which is a common non-surgical treatment that removes plaque above and below the gum line. This is also known as a deep cleaning. And then for looking into surgery solutions, there's pocket reduction surgery, where the gums are basically flipped back and the tartar is removed. Another one is bone grafts, which they basically cut your gums open and they use a fragment of your own bone with synthetic bone and combine it to replace the bone that was destroyed previously due to periodontitis. So going to cryotherapy now, it is known that when the temperature falls below 14 degrees Celsius, the transmission of nerve impulses along the sensory and autonomic nerve is blocked, what is called the cold-induced nephroxia. So this is correlating to cryotherapy since normally it is done at negative 100 degrees Celsius to 150 degrees Celsius. There's a positive association between cryotherapy and relief pain. And the lower the temperature, the lower the activity will be for neutrophils that mediate the pro-inflammatory inducers and cytokines, which and then determines the early local fluid accumulation and consequent swelling or inflammation that you see. So my specific aim 1 will be to lower the concentration of interleukin 6 and interleukin 17 cytokines in gingivitis. My group 1 will be gingivitis patients with no treatment, and my group 2 will be gingivitis patients with cryotherapy tray treatment, creating contact with only the gums and not the teeth. My methodology is the patients would come to their local dental office or dental practitioner, and they would get a 3D scan or they would get a mold / impression. And from this, the 3D scan is then sent, or the mold is then sent to the dental laboratory. Also, before the treatment takes place for cryotherapy, there would be a requirement to use Sensodyne toothpaste, since the mouth is very sensitive, for at least a week before cryotherapy, and also during the treatment itself. And also topical lidocaine will be administered on the gums as you're doing the treatment to help with the shock and the cold. A guard for your teeth will be able to cover the patient's teeth while the cryotherapy takes place, and the material for that will be placed on the gums will be a rubber elastic material. I will be using ELISA to measure the cytokine levels, and I will have 40 patients, 20 diagnosed with periodontitis and 10 diagnosed with gingivitis. 10 of those would be with, and 10 of those would be without treatment for both periodontitis and gingivitis. The treatment will last for 2 minutes at approximately -150 degrees Celsius. There will be 3 sessions per week for 6 weeks, and the inflammatory levels will be taken every week on the 3rd session each week. And then at the end, the cytokine levels will be measured and be compared to the original levels in the beginning before treatment. Specific aim 2 is to lower the concentration of IL-6 and IL-17 cytokines and periodontitis. So my group 1 would be periodontitis patients with no treatment, and my group 2 would be periodontitis with cryotherapy treatment, again creating contact with the gums but not the teeth. So how's this gonna work? I've looked into certain therapies and I found hyalotherapy, and they use this device, as you can see there, that it's called a hyalotherm clinic device that enables a temperature-controlled water flow and the anatomically adapted and very lightweight facial sleeve. So how I will integrate this into cryotherapy, well, instead of using water flow, I would use liquid nitrogen, so then you can get to the temperature that it needs to be. And this will also be on direct contact with the lungs and with the gums, and also instead of using the facial sleeve, it'll go in the mouth, of course. My expected outcomes will be an increased level of anti-inflammatory IL-10 for patients who did the cryotherapy treatment, and decreased levels of inflammatory IL-6 and IL-17 for patients who did the cryotherapy treatment. And then the patients who didn't do the treatment, there should be little to no difference in their anti-inflammatory IL-6 and inflammatory IL-6 and 17 cytokines. And here is kind of just an image to portray what that would look like with the concentration of cytokine levels and the time of the cryotherapy in the weeks. I would like to thank God, Dr. McConkey, Dr. Franklin, and my friends and family for helping me through this. Questions? Oh, question. Yeah.
This stresses me out.
Okay. I did.
You're gonna burn a hole in their gums.
No, it's not burning. So in order for cryotherapy to burn, it has to be like below a certain temperature, which the temperature is only at a -115. When it's used to like burn off things like on the skin, stuff like that, it's at a much lower temperature.
Like what?
Like approximately I think -300 degrees Celsius.
I feel like what I use is -70 Celsius. Now 115 at 2 minutes of duration, you're
Yeah.
gonna have major tissue damage.
Yeah.
And this tissue is so thin. I'm nervous.
Okay.
Where did you
That
get
makes
2
sense.
minutes? Where did you get?
Yeah, I mean, I read about it, and I read about durations of cryotherapy and how long they are, and they're normally between 2 to 3 minutes.
On mucosa or on skin?
This has never been done before, so
No, but that's what I'm
It's
saying,
on skin.
where they, on the studies that you read previously,
Mhm.
was it 2 minutes use liquid nitrogen on skin or on mucosa? Cause that's a big difference.
yeah. So I mean, they would go 3 to 4 minutes on the skin. So I decided to do 2 minutes on the gums.
And what about pain? That was
Yeah.
my thing, that's all I kept thinking, was
Yeah, I know,
even if
that was a
they're
big
numb
concern.
during it,
Yeah.
afterwards, there would have to be significant pain.
Yeah, but that's why there would be the anesthetic gel that would be placed onto the gums for the cryotherapy treatment itself to help with that, as long as it's as well as it's sensitive.
So that lasts 30 minutes is what you're
Right,
saying.
what about after, what about when that patient goes home?
When the patient goes home, there shouldn't be.
You just
pain.
damaged all that tissue.
You burned her.
Yeah,
Yeah.
yeah, I can't imagine how there's not pain. and I'm not certain.
Why do you propose that this is a better option than the current treatments, like a deep cleaning, that you would go in one
Well-
time and this is 3 times a week for 6 weeks?
So this is targeting the inflammation. Like it's just that, it's not targeting the disease itself. Yes, it can attack the cytokines and neutrophils, but it's not, it's just looking at the inflammation and trying to just reduce that. So to make the patient just feel more comfortable and feel better with the disease. Because it's irreversible, there'll always be in discomfort, so I just try to create something that can help with the
Are
comfort.
there other treatments for inflammation?
Not that I know of.
Any more questions? Okay, all right, thank you, Ryan. So our next speaker, we'll let people move around real quick here.
I just see the face. On the other booth.
Okay, so our next speaker is Roxana Varela. She's graduating with a degree in biology with a concentration in medical sciences. She's from Naples, Florida, and has been at SEU for 3 years. Upon graduation, she plans on serving as a missionary. So welcome, Roxana.
Good morning. Actually, my name is Roxana, and today I will be speaking on the pregnancy.
Just a second.
Yeah, hold on 1
second.
Speak up just a little bit, okay?
Once again, my name is Roxana, and I will be speaking on the efficacy of poplar propolis and Brazilian red propolis and gestational diabetes. So, what exactly is gestational diabetes? It is any type of glucose intolerance that is diagnosed during pregnancy around the 2nd or the 3rd trimester. According to the CDC's National Vital Statistics Report in the United States in 2016 through 2021, there has been an increase in the development of gestational diabetes, as we can see here in the first pair of columns. The following columns that we see are divided into different age groups of the mothers, and we can see how the higher the age of the mother, the higher the risk they have for developing gestational diabetes. So a couple of risk factors for gestational diabetes is, as previously mentioned, advanced maternal age, previous pregnancies with GDM, obesity, polycystic ovarian syndrome, also known as PCOS, and a family history of diabetes. The current treatments that we use to manage is eating healthier, exercising, and if needed, we'll give insulin. So studies have shown that GDM is an inflammatory condition that involves an unbalanced production of cytokines, and typically the cytokines that are observed in GDM are listed below. So what's the problem with this? The current treatments are effective, but we need a preventative method. Because GDM currently gets diagnosed too late in the pregnancy. So we believe that treating the inflammation earlier on in the pregnancy should prevent the insulin resistance, which would then lead to a decreased incidence of gestational diabetes. We're planning on doing this with something known as propolis. So propolis is a natural resonance mixture that is produced by bees from a variety of plant sources. It is collected from different geographic areas, and there are 5 main types of propolis. But specifically, we're going to be looking into 2. The first one is called poplar propolis, and this is the most popular type. It's found in Europe, North America, and then non-tropical regions of Asia. It's made from various species of poplars, most commonly the P. nigra, which is shown here to the right. The second type of propolis we'll be looking into is called Brazilian red propolis, and this one is found along the north regions of Brazil. And it's made from the red resinous exudates found on the Dalbergia scatophyllum, which is shown here on the right as well. So studies have shown that propolis has several therapeutic properties, including antibacterial, antifungal, antiviral, antioxidant, anti-tumor, and anti-inflammatory, which is the one that we're looking more into in this experiment. So why exactly are we choosing propolis? So it has been effective in previous studies done with patients that have autoimmune diseases such as type 2 diabetes and rheumatoid arthritis. And type 2 diabetes propolis works by reducing blood glucose levels and decreasing the hemoglobin A1C levels, as well as reducing the insulin levels. At rheumatoid arthritis, it works by diminishing the inflammation, suppressing DNA synthesis and the production of inflammatory cytokines, as well as inhibiting the NFKB activation and decreasing the mRNA levels of TNF-alpha. In this graph, we're going to be looking more into the specific cytokines that we're focused on for this study. So the first one will be IL-10, which is an anti-inflammatory cytokine, and the levels tend to be reduced in pregnancy. The other cytokines will be IL-6, IL-1 beta, and TNF-alpha, which all have a behavior of pro-inflammatory, and they tend to have elevated levels in pregnancy. So for my hypothesis is if propolis, a resin-like material that's made by bees, is taken earlier on in the pregnancy before those inflammatory cytokine levels rise, then we should observe a decrease in the development of gestational diabetes. For my specific aim 1 is to test the effects of poplar propolis on IL-10, IL-6, and IL-1 beta levels that are involved in the inflammatory response of GDM. So we'll be doing that using C57 Black 6 pregnant mice and the gestational days 0 to 10 due to the fact that it reflects the first trimester in pregnant women. For the first group, we're going to be using 10 mice, and they're going to be given the placebo treatment, which will consist of just water given orally via suspension, and then for group 2 will also be 10 mice, but they will be receiving the propolis treatment. So before treatment, we're going to be measuring the inflammatory cytokine levels by ELISA, and then group 2 is going to be given 1 milliliter daily of the poplar propolis via oral suspension for 12 days, and we're going to remeasure those inflammatory levels again on days 5, 10, and 15 with ELISA. The measurements for those days listed above on IL-6, IL-10, and IL-1 beta levels are going to be analyzed and compared to the pre-treatment cytokine levels. What we expect to see is for cytokine IL-10, which once again it was anti-inflammatory, in the placebo group we would expect lower levels, and in the poplar group we would expect higher levels. For IL-6 and IL-1 beta, in the placebo group we expect to see higher levels and then lower levels for the poplar group. Now for my specific aim 2, we'll be looking into testing the effects of the Brazilian red propolis this time on TNF-alpha, IL-6, IL-1 beta, and IL-1 levels are involved in the inflammatory response of GDM. Once again, we'll be using the C57 Black 6 pregnant mice, same gestation days. Group 1 will stay exactly the same, and then group 2 will be given the Brazilian red propolis treatment instead. And then before the treatment, we're going to be measuring those inflammatory cytokine levels by ELISA. Group 2 is going to be given 1 milliliter daily of the Brazilian red propolis via oral suspension for those 12 days, and then we're going to be remeasuring those cytokine levels on days 5, 10, and 15, and we're going to compare and analyze them to the pre-treatment cytokine levels. And the expected outcomes for this is for IL-6, TNF-alpha, and IL-1 beta, we're expecting to see a higher in the placebo group and lower level in the Brazilian red group, and for IL-10, we're expecting to see lower in the placebo group and higher in the Brazilian red group. So in conclusion, this could possibly become a successful preventative method to decrease the development of gestational diabetes, but like with everything else, there are possible limitations, and for this one, we believe that we don't exactly know the side effects that it would have on the mother and fetus, but it has shown effective with type 2 diabetes, so that's why we're trying it out on mice before we actually go on to human trials. And for future studies, I would be looking into combining it with the current treatments that are being used, which is eating healthier and exercising in order to decrease the likelihood of GDM. I would like to thank God, Dr. McConkie, my advisor, Dr. Franklin, and my family and friends for their support. These are my references and questions.
Have there been any studies on the mechanisms that it's been used to treat type 2 diabetes? Do you know the mechanisms involved there? If it's similar to what you expect will happen here?
Yeah, because with propolis, it's shown that it has a lot of anti-inflammatory properties, so we're expecting it to kind of have a similar mechanism due to the fact that it would just kind of go and decrease those inflammation that we normally see in gestational diabetes. So sort of the same mechanism.
So you correlated age with increasing levels of gestational diabetes. What about increasing levels in general in people in America with diabetes? Is that increasing as well? And could that be the leading mechanism of causing more gestational diabetes? Sure. Our population is having more and more diabetes. It's estimated to be upwards of 30 to 40 million people. Is that more what's going on as women enter pregnancy, they become more diabetic because they're already pre-diabetic? Or is it solely due to age?
So I was looking into why the reason why age can have a thing with it, and it's due to the fact that older women tend to already have like an underlying condition such as like hypertension or diabetes or pre-diabetes. So that's why I think what you asked is sort of just the overall aspect of it, that there probably went in already with pre-diabetes.
Question that kind of goes along with his. When you talked about it increasing, you showed us 2 years. Did you look at other years? Or because I mean, was that just a low 2016 and then a high there, or was there that continuing trend in other years between them and before them?
Those are the two.
Can you pull that image back up?
Yeah.
So it said between the 2016 through 2021. So in the CDC website, that's what it said, at least, that it was between those 2 years. I didn't see any other charts or graphs that the CDC website could give me, because a lot. So that's what I was able to find from what they gave.
Because I'd kind of like to know what happened in 2015, and you know, was it higher in 2015 and then went down in 2016 and then back up again, or like is it doing this and they pick those high and low years? And then another question that kind of goes along with this is, can the increase that's showing here be attributed to people being more aware of it, testing for it more? Maybe it was going unnoticed previously, anything like that?
Probably, yeah, that makes sense. As I mentioned, one of the biggest things is that gestational diabetes does tend to get diagnosed late in the pregnancy. So it probably just becoming more aware of it, and people are just realizing it more now. So that's why there's been more numbers increasing.
If the interleukins are elevated, do you think maybe there's a genetic component at all to gestational diabetes, or did you look at any of that data?
Not the genetic components, but everything that I read, it was talking about how more recently, a lot of studies that's been done, gestational diabetes does tend to they think that is an inflammatory disease. So that inflammation plays a really big role in the development of gestational diabetes.
Other questions? Okay, thank you, Roxana.
Is this just something that would be, you know, a treatment for just gestational diabetes, or would it be something possible if there were other, you know, type 2 diabetes or something?
Propolis is actually a supplement that people take already, and they do use it for, as I mentioned, like type 2 diabetes and rheumatoid arthritis, and they have shown that there have been a decrease in the results of it. So that's why I decided to do the gestational diabetes, because no one else has done it due to the fact that we don't know how it would affect the fetus.
So is it eating the honey, or is it eating the honeycomb?
It's actually, so propolis is a mixture of what the bees use to build their honeycombs. Like they used it to, I have a picture of it. So it's this right here, and it's a mixture of like their spit and their saliva and just kind of what they use to build or to cover any like holes or stuff like that.
So you're gonna sell it that way, get your bee vomit, and
No, they have different types of, how the supplement is normally sold either through tablets or liquid form, or they also have a raw form, which I assume it looks